Accidents happen in the blink of an eye, and knowing how to respond can be the difference between life and death. When it comes to bleeding injuries, understanding how blood works and how to respond effectively can be a game changer. There are 3 types of bleeding, from capillaries, veins, and arteries. Capillary bleeding appears as a trickle and often stops on its own. Vein injuries result in a steady flow of dark red blood and require prompt attention. Injuries to arteries result in bright red blood spurting out, a severe situation that calls for immediate action. Now, imagine you're faced with a bleeding injury. What do? Firstly, protect yourself. Wear disposable gloves to reduce the risk of exposure to infectious diseases. Next, rinse the wound with clean water to remove debris and reduce the risk of infection. Cover the wound with a clean cloth or gauze to control bleeding and prevent contamination. Apply direct pressure to the wound to promote clotting and stop the flow of blood. If possible, elevate the bleeding body part above the person's heart to help reduce blood flow to the area. But remember, while these first aid measures can indeed be lifesavers, certain situations require immediate medical attention. These include deep wounds or wounds with widely separated sides, continued bleeding despite applying pressure, arterial or excessive bleeding that soaks through bandages, and injuries from bites, punctures, burns, or electrical injuries. In conclusion, being ready to respond to bleeding injuries can save lives. By understanding the different types of bleeding and knowing how to administer first aid effectively, you can provide critical help in emergency situations. Quick action and proper first aid can make all the difference when it comes to managing bleeding injuries. So, stay informed, stay prepared, and be ready to act when needed.